It seems like it's working. We did this study on how to merge energy system models with environmental impact models, and also with the cost that would come from all these environmental damage we have around the world. And I used to be at DTU, but now I'm at Energy Modeling Lab, which is a consultancy company. So we did this in collaboration with 3 other universities in Denmark, and actually did manage to get the lead scientist on environmental damage in Denmark to be included in this project. So we managed to get some good people. I did this in collaboration with Kenneth, who also are at Energy Modeling Lab now, Kenneth Carlson. But why even look into health impact from air pollution? For one thing, the main impact driver is directly related to our energy and greenhouse gas emission. It affects us by making us sick. We actually have quite a significant portion of the population that gets sick from air pollution every day, including asthma, different kind of lung issues. And of course, all that reflects back to the socioeconomic impact that we actually have a drop in workforce, because people are not able to attend work while sick. What we also found out during this coronavirus pandemic is that the coronavirus is also impacting heavily on areas where you have a large amount of air pollution. So it seems like there is multiple dynamics that if you have a high share of air pollution, it also affects other kind of viruses, diseases that we might attract. And lastly, but not least, there's a significant amount of death included in relation to these air pollutions. In Denmark, the death toll are approximately 4,200 people a year who die way too early. It might not sound so much, but with a population of only 5.5 million, it's quite a significant amount. And last but not least, it's extremely expensive. What previous studies in Denmark have shown is that the estimated cost is around 75 to 80 billion Danish crowns annually, just from air pollution. It's definitely not everything that's coming from Denmark, because air pollution knows no boundaries. And what we actually see is that air pollution is moving around all over the hemisphere and even across the entire world. Not in the same rate as CO2 and other kind of gases, but at least not as local as you might suggest. A bit about the statistics for Denmark. So approximately 30% of all health costs in Denmark are actually only related to Danish emissions. Remaining are coming from neighboring countries, the North Sea, shipping, aviation, and everything else around us. And in total, approximately 20 billion Danish crowns annually can be related directly to the emissions from Danish industries. Besides that, and I thought that might be sort of a good idea of how big of a cost we're dealing with, is that just by the North Sea and the Baltic Sea, so all the shipping that relates in these regions, it is actually estimated that the socioeconomic cost of transporting around here is 1,000 billion Danish crowns annually. So that's approximately 150 billion US dollars every year. And that's just for the North Sea and Baltic region. So basically what you see here on the map, that's blue. So it's quite significant amounts. And we thought it would be a good idea to start looking into how this could be included in energy system modeling, and why we might need to start including it and evaluate on these parameters as well. Which is why we send out, and we have done similar kind of studies before. We did it during the Horizon project REAM, where similar linking was done, but not as thoroughly as we managed to do it this time. we collaborated with most of the universities that are in Denmark, and the methodology behind it is now written down in both by the Danish Climate Commission and also in a small note that we finalized. All the links are at the final page of the presentation if you want them at the end. So how did we actually set up this modeling? Because we managed to do quite a lot of linking in the system. So I will skip everything that relates to energy system modeling, times, Balmoral, osmosis, and so on, because the general idea is that you will just include the emissions in those. And I guess most of you people also know how that's done. So I will focus on the air pollution model, the one called BEAM, and the health cost evaluation tool called EVA. So basically what we have all emission and weather data for the entire world. So global effects that are going into this air pollution model. From that one, we end up having concentration levels of NOx, SO2s, particles, and so on that exist in the atmosphere, and also how they interact with one another, because the issue is not linear. So the atmospheric changes occur at a non-linear pace. So we need to take into account what happens in our neighboring countries before we can actually model it fully in the system. All of this is going into this BEAM model, which comes out with these concentration levels of emissions, that we then include set into this health cost evaluation tool called EVA. In this one, we have the demography, population data, and we also have a cost related to early death, being sick, and all of these things that also occur. So all the socioeconomic effects, but also hospital direct related hospitalizations of sending people to hospitals directly as a result of air pollution. And from this, we end up having unit cost. So basically a price per emitting, so crowns or dollars per kilotons of SO2 or NOx, particle emissions, which we then include into the energy system models. And as you know, we have most of the energy system in these. These models are then used to calculate not only now, but also in the future. But when we look into the future, we actually need to do a full circle again, because when we change the amount of emissions coming out of the system, coming into the system, so if we look at 2030 or 2050, the emissions have changed. And as it is a non-linear problem, we have to rerun the entire air pollution model again to get the new unit cost for the 2030 and 2050 years. And for that, we also had to take into account some progress going on in the general part of the world. So how do we actually track these emissions? Because it's not possible to include emissions on a really local scale in all of the hemisphere. So when we run this air pollution model, we do it at aggregated levels. So we start by modeling the entire northern hemisphere, and to identify the overall greater impacts going on. And in this, we have a grid system of 150 kilometers by 150 kilometers. We then zoom in to Europe, make a tighter grid or smaller grid solution. We move down to Scandinavia or the Nordic countries, and last but not least, we move down to just Denmark. So we have as much of the dynamics we will find. And this model also contains all historical changes that has occurred. So it has been validated according to historical years. So we are crossing our fingers that works just as well for the futures. And basically how you actually run this model is that we run each sector at a time. We run the entire model and then make changes to one sector to have an idea what will happen if we exclude all emissions from one sector, because then we can actually find these unit costs allocated to each individual sector, because there's also quite significant changes depending on what kind of sectors that are actually emitting the different kind of emissions. And from the partners we have been working with, their experience is that the greater the resolution we can run with, the higher amount of impact from the emissions are actually occurring. So in general, this is a point where high resolution has a significant impact on the modeling results. The biggest issue is just that it takes almost forever to run the model. To make a full model run where we have all the data set up takes approximately up to a month, just for one country as Denmark. So it's not something that is easily done. The benefit of it, however, is that this kind of system, because we model the entire globe, is actually changeable. So Aarhus University, who prepared all this data and results, can actually scale this kind of system to pretty much everywhere around the world. So it's a very flexible tool in case anybody else is interested in learning and using this kind of information. And the idea is that we will continue this possibly to Vietnam sometimes in the future if you are lucky. I think actually I managed to get into this well. So basically we just go through all the steps, move down into more regional areas, so closer and closer to Denmark. And in here we then assign these results and costs and all the external costs. I think I forgot I had this one. That's good. And then at the end, we did a post calculation of the health cost. Unfortunately, the study was not big enough, so we would have loved to have it all included directly into the times model. We have it included now, but it's the calculations themselves for the cost of the society had to be done in a post calculation afterwards. Mostly because we wanted the system to be as flexible as possible. So it's not just designed after a times model, but should also be moved to other kind of energy system models. In Denmark, Balmoral is at least a model that is very recognized and used widely, but also just the entire setup was made to be flexible for other countries, so not just Denmark. And well, we basically took all the energy emissions or energy consumption in the different sectoral levels and assigned an emission factor and unit cost to these, and finally managed to get out these emission and health impact costs from it. And those are the results I will go briefly across now. So we found the two main drivers. So Danish pollution in Denmark, what is the main drivers that emit emissions to Denmark? Now we're not even looking at how Denmark can affect other countries, but just how much does the emission we are doing in Denmark today damage ourselves? Yeah.
Mikkel.
Yeah. And what we found was residential and road transport are the biggest barriers. And actually residential, it's mostly wood pellets and firewood that are the great emitters. For road transport, which was actually even less than the firewood we are using today, it was significantly diesel that were the main polluters. Overall, we did this analysis of the three different kind of scenarios, like a reference scenario, a high 70% greenhouse gas reduction in 2030 scenario, and a 70% greenhouse gas reduction scenario, but where we assigned filters on chimneys for firewood. And that is basically what you see here, the three different scenarios and how much the savings actually are. The savings are approximately 10 billion Danish crowns a year in Denmark. And studies have shown that transforming the entire energy sector to become green, it's estimated to come at a cost approximately 15 billion Danish crowns a year. So we are in the order where the health impact costs are actually in the same order or the same magnitude as the cost of transitioning the entire energy system for Denmark. And that leaves us at our conclusion. We could sort of potentially save 10 to 14 billion Danish crowns, depending on our biomass consumption. which match very well with our emissions to, or cost to changing the system. And if we look globally, so also the pollution that Denmark emits to other countries, the saving potential is actually between 15 and 20 billion Danish crowns. So even higher than the cost of transforming our energy system. So it's more to say that there is great extreme benefits from making the green transition. Of course, doing it with not too much biomass consumption in small systems, but it comes with great benefits. And yeah, thanks.
Okay, thank you, Mikkel, for this very interesting presentation and this great work. There is a comment from James in the Q&A section regarding some, suggesting you some further readings that you can look at afterwards. And there is an additional question from Gordon. Do you think loss of biodiversity could be included in your approach? If yes, what added value do you foresee?
I like that question. We haven't looked into the biodiversity at all. We have looked a bit into that land use change, but I think definitely we could include the biodiversity into these kind of systems, because it, as everybody knows, also comes with quite a great cost, the loss of the biodiversity. So it would only emphasize that the green transition is actually at a positive socioeconomic scale, not even including the CO2 emissions and the temperature rise.
There is another question from James. Have you considered including a climate damage function, like Nordhaus this function? We currently have it in Exaptium.
No, not at all. But I think it would be a really good approach to actually include it, because it would probably give us a very good result on that.
Okay. I also have a question. It's just a curiosity. Did you include also ozone impacts in your health impact assessment?
Yes, we did, because it has to be included because NOx emission actually also has a positive effect on the ozone emission. So the air pollution model had to include it. It was not a significant result for Denmark, like the emissions we had in Denmark, but it had a minor effect as well, at least in relation to the health impact and health effects on people.